college can be a challenge. Often the process of just getting accepted can be daunting. One of the more challenging programs to get accepted to is nursing school. This is the story of Joe, my husband, and his experience in nursing school. From prerequisite courses to acceptance to clinicals and the rigor of the curriculum. This story will also look at the dynamics of becoming a male nurse and the stereotypes and limitations of it.
Hey, look who's up! Hi. It must be Greg.
Hello.
Oh, look, somebody had a little visit from the hair fairy.
Nice dude, nice dude.
Hey.
I'll do the intros, Greg. This is my sister, Debbie.
Hi.
Oh, the bride to be.
Nice to meet you.
Congratulations.
And her fiance, Dr. Bob.
Oh, you call me Bob. MD.
These are his parents, Linda Banks.
Hi, how are you?
Nice to meet
And
you.
the world-famous plastic surgeon, Dr. Larry.
Oh, now cut that out.
You know, Greg's in medicine too, Larry.
Oh, really? Yeah. What field?
Nursing.
That's good. No, really, what field?
Nursing.
Hey, why don't I get you a chair, Greg?
Thank you. Thanks.
So, you didn't want to go for the MD?
No, I actually thought about becoming a doctor, but I decided it wasn't for me.
Oh, thanks.
Just as well. Boards are killer.
Actually, Greg aced his MCATs.
You serious? No, I did okay.
Oh, he did more than okay, trust me.
Why did you take the test if you weren't planning on going to med school?
Well, I wanted to keep my options open, but in the end, nursing was just a better fit for me. It gives you the freedom to work in several different areas of medicine. Plus, I can focus 100% on patient care as opposed to being a doctor where you have to deal with the bureaucracy.
Oh, wasn't your friend Andy supposed to be here by now?
Oh, my God.
Essentially, it was just a decision that I made. I just wanted to see if I could do it, whether or not I had the intelligence to do so. It was something that I wanted to pursue early on, but never did because of just fear, maybe dropping out of school early on, college early on. Never got back into it, and my opportunity came where I could do it, and I just decided to go through it. Basically, you're learning everything you can about human care, about caring for people, disease processes, anatomy, physiology, mostly physiology, but just the disease process and how it affects people and how to care for them, treat their symptoms, and be able to advise your doctor of what care a patient's going to require, and if the doctor has an oversight of some sort of treatment, be prepared to advise the doctor on, an oversight of something. Or the school that you go to, some trade schools are really fast where you're only in it for a year and a half. Others, like the program that I'm in right now at Cal State, will take 3 years to complete. And that's outside of whatever you have as far as required courses for that university. I know the junior colleges only have a 2-year program, and like I said, just some of your trade schools that will have about a year and a half. Many university teachers or professors who were in the field or who were in the know will say that the employers will look at the BSNs from from a university, will look at them more seriously as far as getting hired. Whereas your trade schools, they won't really look at you as hard. It might get passed up. Yeah. But you might get passed up if you come from a trade school, but you will still find a job if you have your BSN. It's just a lot harder, when it comes to when you're looking at a Cal State San Bernardino student versus a trade school. student. I think the Cal State San Bernardino student gets the job first. It's very competitive. They were saying out of 900 applicants, there's only 50 spots. And it just depends, it varies, but from 900 to 600 each enrollment time, and there's only 50 spots available, so yeah, it's pretty competitive.
Intimidated you?
No, not at all. I think nowadays when you look at it, my time at the VA, I did a VA rotation, and there was a lot more male nurses than there were female nurses on the one particular area that I was at. So I think the trend is starting to turn to where more men are being hired. But no, it did never occur to me that, it never made me uncomfortable knowing that there was going to be more women. Sure, by the patients, most of my patients that I've seen expect a female nurse.
Even at the VA?
Even at the VA. A lot of them were uncomfortable with me doing procedures that they would expect a female to be doing. So, yeah, just sometimes you just get that, a little bit of that. And I haven't, since being at the VA, I've only seen male patients. I still haven't seen a female patient, and it would be curious to see how that's going to go with that. Yeah, there will be limitations. I know that. Without me being a doctor, I'm pretty sure I'm going to get my fair share of rejections by female patients. Yeah. I have no doubt. I've already heard stories from the other clinical groups who, the male students encountering females and getting rejected by them, and or being uncomfortable, or
right. Despite these low numbers, there have been tremendous improvements in trying to recruit more men into the profession.
What is it?
It's you.
It's me? All right, Emma. I know it's not your favorite, but it's time for your medicine, okay? You ready? 1, 2, 3. Emma, Emma, Bobemma, banana, fana, fofemma, fee, fi, fofemma, Emma. Very good, sweetie. How do you feel?
Good.
Yeah, you did a really good job, okay? Let's go back to drawing.